had a meeting in White River. We had a wonderful turnout. It was a great meeting. And what we did there, and what we're going to do here, is that if any veteran has any need, any claim that they'd like to discuss, we will have somebody talk to you right here. And that's what Sam is doing down in White River right now. So look at you in a few minutes. Before I introduce Dr. Orland and Deb when she comes in, I just want to say a few words, give you an overview of what we're trying to do. And I say this as not just a senator, but as somebody who's recently been appointed to be the chair of the U.S. Senate Committee on Veterans Affairs. It's a tough job. We got $150 or so billion budget. We have 152 medical centers around the country, including White River. We have some 900 community-based outreach clinics, including the one right here in Brattleboro. We have many, many vet centers. And the reason I'm here today, quite frankly, is two reasons. I want to give you an overview, and I want Deb and Dr. Orland to tell you what we're doing here. But we need your help. Uniquely among institutions, the VA is a system that belongs to the veterans. It is your system. It is your system as citizens of the United States and as taxpayers, but especially as veterans. And our goal is to make the VA system as good as it possibly can be. We need your input. We need you to tell us this is what's working, this is what's not working. This is how we can improve the system. So I think we have a pretty good system. It certainly can be better, like every other institution in America. And that's what we hear about. That's number one. And number two, obviously, if there are any veterans here or family members who have particular concerns, we want to hear them. You don't have to get up in front of everybody. We will have staff here who will take your concerns, and we will get back to you in the very, very near future. That I promise you. As an overview, let me say this about the VA. I think the VA has come a long way in the last 20 or 30 years. It is a better institution today than it was then. Right now, there are about 6.5 million veterans accessing VA healthcare every single year. I want to also, in this meeting, and need your help for that, need the VFW's help, to make sure that every veteran in the state of Vermont knows what the VA is offering, knows what benefits he or she is entitled to. You don't have to come into the system if you don't want to. But everybody who has served should at least know what they are entitled to. It is my view that the VA healthcare system is a good system. It is not perfect, but it is generally regarded as one of the best integrated healthcare systems in the United States of America, doing some cutting-edge work. I think today we'll talk a little bit about telehealth, which is a huge breakthrough in a rural state like ours. It means that people can be sitting in their home in a rural area, not only getting psychological counseling, but even getting diagnosis for problems they're having on their body. This is a significant breakthrough. VA is doing a good job in that area. Clearly, we are struggling with some very serious issues regarding PTSD and traumatic brain injury. A lot of our young men and women have come back from Iraq and Afghanistan and in other wars. I think people are more aware of it now. Many other wars with PTSD. VA is doing some cutting-edge work in that area, but we need to continue our efforts. In terms of health issues, one of the issues, the challenges that we face as a nation and the VA deals with suicide. That's a very painful and difficult issue to raise. As a nation, we have a real problem with suicide. That problem is worse within the veterans community. And one of the areas that we want to focus on is especially our older veterans, some of whom will live under financial duress. Maybe their wives have died, maybe they're isolated, maybe they're alone. How do we reach out to those veterans and bring them into the system so that they can get the support that they need? One of the areas that we have worked very hard on in terms of outreach, which to me is very important, because no matter how good the system may be, it doesn't mean anything if people are not in it. We've got to get the word out. We've developed an outreach program here in the state of Vermont, which is now expanding around the country, which says to the men and women coming home from Iraq and Afghanistan that we have veterans, through a veterans outreach program run by the National Guard, who are knocking on your doors, hearing what's going on, talking to wives, talking to kids. So we are, I think, running a pretty good system. I'm proud of the new CBOC that we have down here. We'll talk about that in a moment. But we can always do better, and we need your ideas as to how we can do better. I want to also mention that in terms of better benefits, one of the major benefits improvements that we've seen in recent years is the post 9/11 GI education bill, which I hope everybody is familiar with. In my humble opinion, one of the most significant pieces of legislation ever passed by the United States Congress, this was the end of World War II, was the GI Bill. You all know what that was about. And we said to the men and women who served in the war, thank you, and now we're going to help you get a college education. And out of that came a whole generation of folks who went into business, went into professions, helped rebuild the American economy. And we were not, that success of that program was not lost upon us after 9/11. We started a new GI education bill for post 9/11 veterans. Over 900,000 veterans or family members are now utilizing that program. In a program that big, there are some problems in it. If you have any, I'd like to hear about it. We're trying to address that issue as well. An issue that has been getting a lot of attention lately, which is a serious, serious issue, is the backlog in VA claims. And let me say a word on that. For whatever reason, and I don't even want to speculate, the VA was one of the last major institutions in this country to go from paper to a paperless computer system. And ironically, they have a very, very strong health technology system, really advanced, the VISTA system, but for some reason, in terms of claims, everything was still paper. And you have some claims that are this high, or complicated claims. In 2009, General Eric Shinseki became the Secretary of the VA appointed by Obama, and he pledged to move the system from paper to paperless, and by the end of 2015, his promise was that every claim would be processed within 125 days with 98% accuracy. And right now, the VA system is in the midst of a huge transformation, going from paper to paperless. And I'm going to work with the Secretary to make sure that that promise and that goal is kept. But right now, we have a situation where in some cases, and we bumped into some in White River, people have filed claims and they are not getting them adjudicated for several years. That is unacceptable, period. That is not the way the system can or should operate. But I want you to know that we are working very hard on that. If anybody here has a claim caught up in the backlog, talk to my staff today, and we will see what we can do to expedite it. Last point that I would make is that we will have about 1 million men and women in the armed forces transiting out of the military within the next 4 years and coming into civilian life. And what we want to do is to make sure that every one of those folks who wants a job is able to get a job. Now, right now, Vermont is doing better than much of the country in terms of our unemployment rate, but there are areas of this country where real unemployment is 15–20%. So we're working on a number of approaches to make sure that when men and women come out of the armed forces, often with good skills, that they're able to find decent paying jobs. So that's the overview. What I want to do now, and she has just walked in, good timing, is introduce to you a woman who's already begun, I think, to do a great job for us. Her name is Deb Ander. Deb is the director of the White River VA, and in the sense of all VA operations in the state of Vermont. Before she came to Vermont a few months ago, she worked in Washington, helping to put together a very important program, which we're trying to expand, called the Caregivers Program. And she has been in the VA for many, many years and brings to us a whole lot of experience. So if you will, please welcome the new director of the VA Medical Center, Debbie.
Quite as fast as Senator Sanders. Well, good afternoon. It is just such a pleasure to see such a full room here. These kinds of events are extremely important to us because they give us an opportunity to hear from all of you in terms of how we can best meet your needs and make changes and enhancements to our VA healthcare system. I want to start by saying, first of all, to all the veterans who are here in the room, thank you for your service. And then to say that this is your healthcare system. We feel very, very strongly in White River Junction and in all of our healthcare centers across the state of Vermont that you are our partners in the provision of health care for veterans. And so it is very important that you have an opportunity, and we have an opportunity, to hear from you in terms of how we can best continue to grow and develop the health care system that we are building throughout Vermont. And in particular, we want to hear about the things that are going well, the things that you would like to see us add, and then I think most important from my perspective is what's not going well? What do we need to change? So one of the things that I think has become a real focal point in VA is our primary care system. And I know that those of you who frequent the Brattleboro Clinic really benefit from Dr. Orland's provision of primary care, and Sharon Levinson over there. In primary care, I think VA has come a long way. We used to have a system where we were pretty much telling veterans how to take care of themselves. And I think we've seen a real shift in recent years towards health and wellness and quality of life and partnership. And what that means is that you're not only partners in the overall healthcare system, but you need to partner with your healthcare providers in terms of responsibility for your healthcare. So we're doing a lot of programs like our MOVE program, which is focused on exercise and weight loss. We offer that through telehealth at the Brattleboro CBOC. We're really proud of our telehealth programs. I know that many of you have benefited from them here in Brattleboro, giving you the opportunity to see some of our specialists who are at White River Junction via telehealth. We are going to continue to grow and develop that program, and also to make it more available to folks at home, so that we look forward to a day when you can actually see your therapist from a telemonitor that you have in your home. Goal being that we make care accessible and convenient for all of you. We do provide a whole range of specialty care. Again, part of the way to bring that to you is through telehealth, so teledermatology, telepodiatry. We actually are offering physical therapy via telehealth. I didn't believe that could be done when they first told me they were going to do it. But actually it's really working very well for some of our folks who have had surgeries like hip replacement. We do have in our Brattleboro CBOC and all of our community-based clinics access to mental health care. One of the things that VA has really focused on is making sure that mental health is not something over here in our healthcare system, but that it's part of our primary care focus. And so when you come to a primary care clinic, you have the ability to see a mental health provider right then and there. And that we have social workers, psychologists, and psychiatrists who we are part of that primary care team and in addition to providing mental health services. We have a couple of new programs that I just wanted to share with you. I don't want to take up too much time because much more important is our ability to hear from all of you. But we are very pleased to say that we have just gotten funding to add ophthalmology services. Now, we've had optometry services for quite a while out of White River Junction. But what we have not had is cataract surgery. So we've had to send folks all the way to Boston to get your cataracts done. That's no longer going to be the case. We are hiring an ophthalmologist who will do cataract surgery at White River Junction. We are also developing a sleep study program. Lots of veterans have challenges with sleep and could benefit from sleep studies so that our doctors know how best to treat their sleep problems. And we're actually developing a program which is going to use, in large part, home sleep study equipment. So for those of you who don't live right near White River Junction, we'll set you up to do the sleep study at home, actually, and then work with you in terms of what treatment you might need to fix your sleep issues. We will still have some sleep study capabilities at White River Junction for folks who really can't or don't want to do this at home. And then we also have just recently gotten permission to get a mobile PET scanner. So again, we've had to send folks all the way to Boston to get PET scans. Very challenging for some of our veterans who have cancer and other serious diagnoses, so it's going to be great to be able to provide that right at White River Junction. I think many of you may know, I assume Senator Sanders may have mentioned that we have our new Women's Comprehensive Health Center in White River Junction, and we really want to encourage you to get the word out to our women veterans to come and take advantage of the comprehensive services there. And then we've added a residential recovery center which is focused on not just PTSD but substance abuse treatment. And I can tell you we've had 88 graduates from that program, and they talk about it being life-changing for them. So an important new resource as well. But you know, I'm very much committed for us to continue to grow and develop. Dan Moriarty's never going to forgive me if I don't mention this time. He's a member of our staff who runs our geriatric service line, but we have, he's raising his fist, see? We have a great array of home care programs that we offer through VA, our home-based primary care program, but then also nursing care at home and all sorts of other resources. And the goal of all of those programs is to make sure that as veterans age or have diseases that make it difficult for them to manage at home, that we put the resources right at home for them so that they can stay in their own homes, so that you can stay in your own homes. So again, I thank you all for being here. We're really open to taking questions. Let me say one more time, this is your healthcare system, and we want to hear from you. Thanks to Dr. Sanders, I didn't know that you tried to help your own side. I do think we're incredibly fortunate to have Senator Sanders, not just in Vermont, but now across VA, and want to thank him and his staff for making this possible.
A few years ago, Sam Haskins told me over and over again that for whatever reason we did not have a CBOC in this part of the state. So we worked hard to have a CBOC now. It is a beautiful facility. And I'm proud to introduce to you the physician who runs the facility, Dr. Richard Orr. Dr. Orr.
Prepared a speech, but I knew I was going to have such a crowd. So thank you all for coming, and I hope you enjoyed the festivities, and we really want everybody to have an opportunity to give us some feedback. And here's your opportunity, because my boss is here. So we want to hear. But I want to make one point about the CBOC here in Brattleboro. There are many veterans in the community that can access this facility and still don't. And in some cases, it's because people don't know they're there, but it's also because they don't know that they can. And the point I want to make is that even if you are cared for by a physician or a provider, any provider in the community, you can still come to us if you serve and if you qualify for benefits through the VA system. And we encourage you to do that, and we would like to collaborate with your non-VA providers and make it easy for you to access the benefits through the VA system and still be able to choose the physician or the care that you want in the community. And people don't understand it. They think that they can only come to the VA, that they can only see their doctor in the community. That's just not the case for many of them. So if that word or that message hasn't been put out there, I want to make sure that that's everywhere. I completely didn't have much else, but thank you for coming.
Steve Robertson, some of you know Steve. Steve was the legislative director in Washington for the American Legion for about 20 years. Did a great job. He's been on my staff for a number of years now. He's now a staff director at the Veterans Committee. Okay, the meeting is yours. Do we have any microphones here? Or how are we going to do this? Okay, if you could just give us your name and fire away on any questions or comments.
Senator Sanders, thank you for coming here today. A couple of things. One thing that was in your flyer that you just mailed out, I believe the VA was starting Category 8 again. There's probably some people here that don't understand what Category 8 is. I wondered if you could address that. And also, I noticed today that the director of the Vet Center is here, and that's another great thing that the VA has going for it.
Thank you for the question. There has been a debate within Congress forever about VA eligibility. Who's eligible to walk into the VA? Everybody acknowledges that people with service-connected problems, of course, are going to walk in and get health care for the rest of their lives. That's never been debated. But what happens if you're making $45,000 a year, you don't have any service-connected injuries? Should you be eligible for VA? There has been a debate about that issue for many, many years. Obviously, the more you open the system, the more expensive it is to the VA. On the other hand, if you provide, as the VA does, good quality, cost-effective health care, and you bring people into the VA, you save the healthcare system in general significant sums of money. So priority 8s are folks who do not have service-connected or above a certain income level. When Clinton was president, he opened the doors and he said, as I understand it, if you're a veteran, come on in. And you know what happened? Veterans came in. And some people believe that the VA ended up spending more than they should, a lot of money, and they cut back. Under Bush, there was an income level put in, which depends upon where you live in America and the cost of living in a given area. I happen to believe that it makes sense to open the door as wide as possible. So right now you'll have a veteran who's making $25,000 a year without service-connected problems getting into the VA, somebody who's making $40,000 or $50,000 not getting in. That's an issue we're going to look at, and I believe we should, to the degree that we can afford it, open the door as wide as possible. With reference to the vet centers, Vet centers play, in my view, a huge role, and I am not sure that everybody knows the role that they play. The beauty of vet centers, and we have 2 in the state of Vermont, the beauty of vet centers is you can walk in the door. Often the centers themselves are run by veterans. They're much more informal than the VA, less bureaucratic. And you can get psychological help, you can get marital counseling, you can get a whole lot of services. And I believe that we are not fully utilizing the vet centers in this country. So people have more questions about the vet centers, we can get into greater detail about it. But we have 2 in the state of Vermont, 1 up in South Burlington and 1 in White River.
My name is Northern Carl Smith, and my question is, I've actually been asking this.
We're having trouble hearing you, please.
My question is, I've actually asked this several times, I still haven't done 100%. Was if you're getting treated for mental health or anything for VA, and if I'm finished after I'm done with school to go for a federal job, would they be able to access my record? Would that be any way that could hold me back anyway?
Joseph, that's a very good question. I'm going to ask that to answer, but before I do, what Joseph touched on, and actually relates to the vet centers. Here's the issue. The people who serve in war do not come back the same people they were when they went on. And if we've learned anything in recent years, is what, call it PTSD, call it whatever you want, with TBI, people have had it forever. If you see a comrade of yours injured or killed, or you kill somebody else, or you go through the hell of worrying whether somebody's going to blow you up, that takes a real toll on people. And one of the problems that we've had, frankly, is that people come home who are hurting, but they want, for example, stay in the military. And they're worried that if they say, I have these problems, somebody will say, well, thank you, but we don't want you at all. But I want Deb to answer that specific question.
Well, thank you for asking that. It's a very important question. First, let me commend you for wanting to pursue a federal job. But we select the VA as a place to work. Privacy and confidentiality is extremely important, particularly when we talk about mental health. So know that your records cannot be released without a release of information, and you signing that release of information. So VA abides by what we call the HIPAA regulations, which are created to protect privacy and confidentiality in terms of healthcare records. So important to know that, and no, we would not release anything to a federal agency or potential employer without your permission to do so.
Yes.
Well, I just have a question. Back when I was in the Army, my blood pressure went up. I absolutely couldn't read it. What they said was high. And I'll tell you right now, it gives you a hell of a headache. But today, I can't get compensation because I can't get records from the local doctors anymore back 50 years, and if I can't get blood pressure records, I can't prove that it carried on that way now. When they discharged me, they took my blood pressure 4 or 5 times and finally just wrote in something so they could get rid of me. And so.
All right, my suggestion to you is that at the end of this meeting, talk to this gentleman right here, who will take your name and your phone number. We'll see if we can pursue it, okay? And by the way, let me reiterate, not everybody has to stand up. You're welcome to talk about your personal issue. But at the end of the meeting, Steve Robinson will be here, and I suspect Sam Haskins will be back. Dan, where's Dan? All right, Dan is there. All right, and you give one of these people your name and well. Dan is moving very fast. He has a... Service filled up now? Okay. Yes.
I think you can hear me without my...
Your name is?
Jane McCauley. I'm State Director for the State of Vermont for the Waves. And I have come with two questions today. One is a member of my unit who went to White River yesterday for some treatment. Her question for me to ask you today is, why does she have to go to the women's clinic and then back to the hospital for her treatment? Why could she not go to the doctor directly?
So not knowing the specific circumstances, sometimes specialty clinics do request that a primary care doctor evaluate somebody initially and then make a referral to a specialty clinic. So that potentially is the case. But it's hard to comment without knowing specifics. I think it is very important, though, that we make things as convenient and as accessible as possible. So again, we're going to ask Dan to maybe get her name, and we can reach out to her and see if there's some way we can arrange her appointments in a way that they are going to be more convenient for her.
Thank you. She was hoping she'd be here today, but she had appointments yesterday, and she needs a driver. So they had to take her yesterday, and they said which was most important for her.
Yeah.
And so she didn't show up. But I have a question for perhaps Senator, I'm calling you Senator Sanders. I wanted to say doctor also. Because you are a doctor, and I realize that from the years that I have had the privilege of knowing you. But at any rate, my question is, and I understand your itinerary today is to take you to Bennington. When you're there, I hope you have an opportunity to tour the home. I look forward, and I've been and toured, and I'm sorry to say that the rooms that are available are not very welcoming, plus the fact that the corridor, you have to share the shower with the men that are in that corridor to congregate shower. It blew my mind. Is that not the situation? I toured the building, and that's all I could find. So when you're there today, please look into that.
Jane, as a matter of fact, first of all, let me thank Jane and the Waves. These women were way ahead of their time. They paved the way for the huge changes we've seen in the military with regard to women. And as Deb just mentioned, one of the reasons that we are establishing women's clinics in White River all over this country is to acknowledge the contribution of women and their special needs. Now, as it happens, I'm heading to Bennington this afternoon, and the first person I'm going to meet when I get to Bennington is the director of the nursing home there. So we're going to take a hard look at that.
Good afternoon, Senator. Peter DeMarco from the VFW in Springfield. It was all over the news this morning. Something very disturbing came out that due to sequestration, that a lot of VA personnel are going to be furloughed, which would result in thousands of veterans coming back, wounded veterans. They're going to have to wait in the line for health care. It was on the news, so I was just wondering if you do anything about it, or if that's happening, as a senator, you could do something about it.
Well, Vito, thank you. Vito with DFW in Springfield does a great job. Vito, I'm happy to tell you that the information that you received is inaccurate.
Thank you.
Every now and then the news media gets it wrong. Except for Tim. Tim always gets it right. Brattleboro reform, always right. But other than that, no. In fact, look, I don't want to get into the whole business of sequestration, which is a disaster. But the VA has been exempted from sequestration. Where veterans will be impacted is employment programs often come to the Department of Labor and HUD. Those have been impacted, and there will be other ways. But the VA itself has been exempted from sequestration, as it should have been.
I am Margaret Newton. I'm a retired physician. I am not a veteran. However, I've spent quite a number of years in veterans hospitals in Milwaukee and Madison, Wisconsin. And I am really impressed by the work that's being done to increase the percentage of veterans who have not been eligible for the VA care, that you're working on the problem from many standpoints. I'm still very concerned that there's over 1 million uninsured veterans in the United States, and one of the problems I see about these different federal systems, the Medicare is a beneficiary option, so that if you're 65, you can have Medicare. If you're a veteran has a budget. The Veterans Administration has a budget, and they can only shrink and they can only do so much with a budget for a given year. So that could be a problem. But nevertheless, we have maybe 1/3 of the veterans are not covered, and where do they go from here? Now, the older ones can do Medicare, and they do, but then there are other options that are all very different. There are different standards. So what I think is every veteran should be entitled to equal standards all over the U.S. and at all times. That's what I want.
Margaret, I agree with you. Here's the argument against it. I mean, I think, here's the argument for it, which I think is the prevailing argument. Do we as a nation believe that everybody is entitled to health care? I do. I suspect most of you do. Do we believe that all veterans, with their lives on the line to serve this country, are entitled to health care? I think most of us do. Once you make that statement, they have to acknowledge more people come into the system, it's going to cost us money. That's the simple reality. On the budget committee, those are issues we deal with. On the other hand, I think it is money not only well spent, it saves you money at the end of the day, because if somebody does not have access to health care, what happens to them? They will end up in the emergency room at 10 times more per visit than they will visiting Dr. Orland. They will get sicker and end up in the hospital at much greater expense than if they were treated when they were initially ill. So I think it makes sense, and it's an issue we have to deal with. Obviously, there are folks in Washington who do not necessarily agree with it. Now, one of the things that we have done, and done pretty well, is what we have said to all of the service members who served in Iraq and Afghanistan: you're going to get 5 years of free health care at the VA, correct? All right, so we reached out in that direction, but we still have a long way to go. No veteran in this country should be without health care.
Yes, good afternoon, Senator. In regard to what this lady was just addressing, we have a very large growing population of uninsured veterans who are unemployed, and as a result, they're also homeless, and they're in a state of destitution. When are we going to be able to do something for them?
First of all, if they are below a certain income, and the income varies depending on where you are. Do we have any idea what it is here in Brattleboro? I don't know if anyone knows. If they're below that income, we've got to get the word out. They are entitled to free health care at the VA. All right? And I think one of the things that concerns me, we're trying to work on it, because the VA is so complicated, and healthcare is so complicated, is to get the word out in English to people to know what they are entitled to. But if you know of low-income veterans, they are entitled to VA health care. And I'm sure, Dr. Olin, at your facility, you can help people sign up for the program. Or if anybody in that position is here today, Steve is right here, we can sign up. In terms of homelessness, as I mentioned earlier, homelessness among veterans has been for years a national disgrace. We have 60,000 veterans who are homeless. Some of them will sleep out on the streets. The President and Secretary Shinseki made a commitment to address it, and in fact, in the last few years, we have had some good progress. Not as much as we wanted, but homelessness among veterans has gone down in a not insignificant way, but we've got a long way to go. So we're working on it. In fact, there was just some funding came in the other day from the VA and HUD to help us a little bit more.
Okay.
Working?
Yep.
My name is Russ Dawson. I'm from Rebecca, Vermont. And I want to talk about a little known secret of the VA called ALS, Lou Gehrig's disease. A few years ago, I read in the New York Times that the VA was going to take care of every veteran, male or female, it didn't matter where they served, when they served, they would get some free health service. Excuse me. My oldest son-in-law's father had contacted Lou Gehrig's disease, so I got in touch with him right away. He got in touch with the VA, and I'm glad that we can talk about this here, because every veteran should know that if they get Lou Gehrig's disease, or ALS, they get a lot of benefit from the VA. But VA, for some reason, keeping a secret. Not mentioned in this booklet. It's not mentioned in the little booklet that we get. Now, when we go see doctor here, they have the abbreviation ALS, but they don't say anything about it. I would just like to have everyone know that my oldest son-in-law, father, got ALS. When he died, the VA paid all of his funeral expenses. His mother got her house tax in Florida paid for the rest of her life. That was worth $3,000 a year in property taxes. She was also enrolled in the Chance, which is a free insurance for veterans. And finally, she got $1,200 a month. And nobody knows about it. I happen to have a person I met in Jamaica, and I know her husband had been in the service. And I said to her, did you ever hear of this program I'm talking about? And she said, no. And I said, well, I don't know if it's retroactive or not. But get in touch with the VA. And she said, well, that's interesting because my husband was being treated by the VA in Bennington for this ALS disease. Later I saw her, I said, are you getting all this benefits? And she said, yes. I'm getting my property tax being paid for. I'm getting $1,200 a month. They reimburse me for his funeral costs.
Russ, let me interrupt you. You make a very good point. And the point, Russ is focused on ALS, which is, we all know, is a degenerative nerve disease. Frankly, here's the problem. The Veterans Administration does run, in my view, a good healthcare system. You know what the problem with the VA is? They do a poor job in outreach. Now, I remember, probably was 10 years ago, Dan, I don't know if you were with me at the time.
Yes, sir.
Sam Haskins and I ran around the state to tell veterans just what Dr. Orland had told them, that if you are seeing another physician, you can still get into the VA, and if you have a chronic health problem, you can get your prescription drugs at the VA at a very low cost. And you know what? A lot of people did not know that. And as a result of those VAs, a lot of people came into the VA. So the truth of the matter is, for whatever reason, we're working on it. We're working. Your point is exactly right. There are a lot of benefits out there that people don't know about, and frankly, the VA has not done a good job in terms of its outreach. So that is one of the areas that we are concentrating on. People don't want to come into the VA, that's fine. But every veteran should know the benefits to which he or she is entitled to, which is one of the reasons we're here this afternoon in Brattleboro.
Senator, if I could just say for a second, the gentleman is correct in terms of the ALS. The VA Secretary made a decision about 3 years ago that any veteran who came down with Lou Gehrig's disease any time in their life, the individual, all they had to do was apply to the VA and they would be given 100% service-connected condition for it. We do a lot of outreach at our medical center, and I think Vermont is one of the leading outreach programs in the country in terms of doing that. We do a lot with local hospitals, local neurology clinics. We have one of the highest, unfortunately, ALS populations that are seen in our spinal cord injury clinic. And you're exactly right in terms of once you get service-connected for the disease, although it is terminal, you get just about anything that you possibly need.
But it's so well kept.
Yes, it is.
It is, there's no doubt about it, and we need to do a better job, as the senator says, in terms of outreach on it. Yes, sir.
People employed by the VA don't even know about it. Because I've asked them.
Okay, Phil, you have a question? Yeah.
Mike Lenningham from Whitingham. My question has to do with specialty care. I was recently diagnosed with cancer from my deployment to Balad, Iraq, and needed surgery. And I was hoping that I could get my surgery in White River Junction, and I was told that the specialty care for that particular surgery I would have to go to New Haven, Connecticut. Now, I did do that, and I did get care there. My question is White River Junction planning to do some sort of relationship with Dartmouth Medical Center?
Thank you for bringing that up. We do have that relationship with Dartmouth Medical Center, and it's correct that, Senator Sanders has said, we're a fairly small VA. For a VA our size, we have a lot of specialty care, but there are some more complex surgeries that we don't do at our facility. Now, in general in the VA, we do, if we have that available within a reasonable distance within our network, we will send the veteran to another VA facility. But we do also have a relationship with Dartmouth, and actually right now we're working on the ability to have some of our physicians, our surgeons, operate on veterans at Dartmouth just because they have better systems in place to take care of more complex cases. So.
Okay, thank you. One more question, please.
How was your care in New Haven? Was it good?
Excellent care. I was in the hospital for 24 hours and then back home. It's just,
That's a good point.
it's the travel time.
Well, here's the issue.
It's the whole.
Here's the problem you can understand. Is not every facility can deal with every complex issue in surgery. It would just be too expensive to do that. But I think we're seeing that why not an expansion of specialty services in White River.
The other question is, we mentioned that we have vet centers that are in South Burlington and White River.
Yep.
Are there any plans for having a vet center down here, because a lot of our veterans aren't able to drive?
We have one in Keene, do we not?
Yes.
Okay, do you want to say a word?
Yes, I'm Dr. Brenda Eastman. I'm a
Get the mic.
Thank you. Appreciate it. Hi, I'm Dr. Brenda Eastman. I'm a clinical psychologist, and I'm the team leader director of the Vet Center in White River Junction. And we're very happy that we were able in the past couple of years to open a vet center location, which is part of our vet center, but it's its own physical facility, staffed full-time by 2 licensed clinical social workers, real experience working with vets, combat vets, in Keene. It's not in Brattleboro, but it is in Keene, New Hampshire. And so that's not as ideal for you as having it right here in Brattleboro, but it certainly is a leg up over driving to White River Junction.
All right, and if you need any more information about what vet centers do, you're going to be there at the end of the meeting.
Absolutely, I'll be here. Absolutely.
Vet centers do a great job, and I think, we talked about how the VA doesn't get the word out. I think we don't get the word out enough in terms of vet centers as well. So vet centers are there. If people are having, combat vets are having any one of a number of problems, family members can come in, right? So let's take advantage of vet centers.
And let me briefly add, not only family members, but vet centers are very flexible with their criteria, their definition of family. So it may be someone's girlfriend, fiance, family might be the girlfriend's teenage children that are, triggering the vet and creating tension. Pretty flexible place in general.
Okay. Other questions? Yes, sir.
Dr. Kress. Sir, I'm from Maryland, and I was just visiting the area, and I saw in the newspaper where you were going to be here, so I wanted to make it a point to stop in and just tell you that it's great. You're the right person for the job to sit in that chair, and I look forward to a lot of the leadership that we get in the years to come. You mentioned 125 days with 98% accuracy. Honestly, the DA has tinkered around with this for the last 3 years. They have done pilot programs, they have training conferences, and they have 57 regional offices out here to process these claims. Now they have teams all broken up over the country where they'll send your claim to get post-developed and then go in front of the BSR to get ready to do decision review on it. It seems very fragmented. Then the other thing is asking for input. There seems to be very little industry outreach to help find a solution to the backlog problem. Short of hiring contractors to build systems. The problem is so big and so important that the VA needs to bring together the best the country has to offer to help develop a solution quickly. This is something the VA has not been able to do by themselves. And that's what I'd like to mention.
Okay. Thank you for your thoughts. Steve, did you want to?
I'm Steve Robertson. I'm the staff director for the Veterans Affairs Committee. Just to let you know that when they decided to go from paper to digital, they brought in every major corporation and sat down with them to try to figure out exactly how to make this whole process work in the best manner. And they brought in Federal Express, they brought in major corporations, insurance companies. I mean, the list goes on for very long. And they have, you're exactly right. Secretary Shecki, let me start off. I've been around for 28 years in the veterans business. And I've seen people try different things that just crash and burn. But Secretary Shecki did something that I've never seen any veterans secretary do before. He took the system completely apart and tried to fix whatever it was that was causing bottlenecks. And yes, it did cause a backlog, but he was trying to get it right and get it right where it worked each and every time. I am very optimistic that they've taken the right approach. Now, whether they're going to reach that goal or not, I'm not 100% positive, but I'm telling you, he has done stuff that his predecessors never even tried to do. And I think he deserves a lot of credit for that. Just having the stuff electronic where they don't have to shift the records physically from one location to the next. I can tell you, I have seen a veteran's file, that was in a 5-drawer filing cabinet. The whole filing cabinet was his claim. Now, can you imagine having to ship that from Baltimore to White River Junction for somebody to go through to make? So I think they're in the right path. In addition, we've had veteran service organizations come in and testify. 3 major organizations, the Legion, the VFW, and DAV came in and told the senator, they're right on target. They're doing what needs to be done. And again, we're going to try to track them as best we can to make sure that they achieve their goal.
You've asked a very good question. And I think what Steve is saying is 2 things. They are undertaking a massive transformation of the system. And they're going to be, trust me, there will be problems within that. But I think if you go to Washington and you talk to the American Legion or the DAV or the VFW, what they will say is, yep, we think we're moving in the right direction.
Ronald Word, 1951, I joined the U.S. Army. Within 24 hours, I lost 90% of the use of my right hand of getting frostbite in it, from standing out for 3 hours over 20 below zero. I put in a claim trying to get below an 8. They turned me down. The reason was that I joined the Navy a year later, which was great until they caught up with my Army discharge and got rid of me. And I think I got a royal shaft. I don't care what anybody thinks. I'm going to tell you right here now, I damn near left the VA after that for the simple reason I could buy 2/3 of my medications for less than they would cost me in the drugstore. And I haven't been a happy camper since, and I'm not now. Thank you.
Okay, Ronald, thank you for your service. Let me say this. Sam, okay, you guys done? All right, we'll try to deal with your case. You raise another issue, though, which is what we're dealing with. In general, if you have a serious medical problem and you need a prescription, a prescription drug that's expensive, the likelihood is you're going to get it far less expensively at the VA than it costs. Is that right? All right. However, what's happened in recent years, it's not a bad thing, is Walmart and some other large companies are now providing generic drugs at very, very low prices, right? In fact, at lower prices, I believe, than the VA is. And this is the sum, and that is an issue that we want to deal with. So I tend to think that the VA should be able to match Walmart because you want people getting their medicine in one place. So that's an issue, it's an important issue, it's one that we're going to address.
Hello, my name is Tom Burns. I was hit in the head in Vietnam back in 1968, paralyzed one side. Now, whenever I tell somebody that, I always add that the paralysis is the bad news. The good news is, my name is not on that wall. 58,000 didn't get that, so I'm pretty lucky to be here. And I've known this guy for lots of years. I can't say I always, maybe sometimes, agree with his issues, but I can tell you one thing. We can't believe how lucky we are to have him representing us in this country. Believe me, folks, I've seen him in operation, and we're just so lucky. Now, he may not answer your phone. Now that he did, we say something good about him. There's been a lot of years that we've argued, and it's just so wonderful. I just wanted to tell you that you all need to get the friends that you know that aren't here today, who are veterans. We need to call him, but we need those veterans to use the hospital, because this, I'm telling you, and you all know this, it all works on the numbers down there in Washington. Right. So they make a decision to loan or to get some money to you. It depends for us here.
Tom is exactly right. That's right. If you have underutilized facilities, VA is not going to fund them, and they shouldn't. So our job is to make sure, it gets back to the same point several people have raised. If you are eligible for a benefit, take advantage of that benefit. If you can come into the VA and you want it, you're going to get good quality health care, you should do that. Okay. Tom, thank you very much for all that you've done.
We can see why you're the senator. You did a much better job than I did.
I got a few years practice on it.
For just a minute, because of your staff and Dr. Gordon being here, this is one of the important questions, and I've seen it raised today. Is there no thought or concern about us overlapping? I'm glad that Keene is having the privilege that we have in Brattleboro. However, I am also concerned about the numbers that are included in Brattleboro.
The answer is, the answer is that the VA obviously is not going to set up a CBOC or a vet center in every other community. They want to locate them where they think there is a vet population that will utilize them. And one of the concerns we've had here, and I think we're seeing some progress, is to make sure that this beautiful CBOC, you all visited the CBOC here? It is a beautiful, beautiful facility. And we want everybody in Windham County, and our friends in New Hampshire, or whatever, to know about it and to utilize it. So the answer is, these, whether it's a CBOC or a vet center, they're located in particular areas for particular reasons. So,
yeah, thank you. Dave Mulholland, I'm a local dermatologist. Back when the Wounded Warrior Bill was being written, there was a lot of emphasis on community partnerships. And so I'm wondering, as you move forward, Senator, whether you see that as a continuing priority and whether the VA would be allowed to consider successes when its members or its charges are further integrated into the community by taking advantages of services, perhaps ancillary services. So I think there's a lot of credit that should go to the VA there for helping that type of community reintegration.
the answer in one word is absolutely. We are seeing a hearing on that. There are tremendous groups all over this country, often private nonprofits, who are working hard to help veterans, and we have to develop better coordination between the VA and those facilities. There are some other issues that are out there. For example, recently, the VA has worked with the Indian Health Service, not of great relevance in Vermont, but in Alaska it's a big deal, by which veterans can walk into an Indian Health Service and get their care paid for by the VA. How we can expand that concept is something that is under study. Yes?
Thank you. Doug McPhee from Bellows Falls. First off, like Mr. Burns, I don't always agree with you, Senator, but one thing that we do agree on is Veterans Affairs. And I'm pleased to see that you are chair of that committee. I have a concern. I have two questions. One's a concern. I go to the White River Medical Facility for my primary care. I want to continue to go there. I'm very pleased with my physician, Dr. Alex Grossman. I get it a punch to her. I don't want to be told that I have to go to a CBOC, and I'm a little concerned that as numbers get to a certain area, that's going to happen to me. I want to continue to go to White River.
Look, I've been given it to death, but I want to say this. We have picked up some concerns, which we are addressing and I think have dealt with. At least I'm told we have. And this is the concern. The concern is that somebody has a doctor, say in White River, who they have gone to for many years and feel very comfortable with. And what the VA has said is that if you can get, quote unquote, the same care at a CBOC, we are not going to pay you travel reimbursement to go to the facility you were previously going to. What we have said to the Secretary, and I think this is being rectified, is if somebody is happy with the care that they have, they should be allowed to continue going to that doctor and to continue getting reimbursement, travel reimbursement. If somebody is new in the system, they should go to their local physician, the local CBOC. Do you follow what I'm saying?
Yes, sir.
Okay, so we're working on that. Should Debbie want to?
Yeah, just, I think one of the things that we really pride ourselves on is that we do have a primary care system where people develop relationships with their physician, and that's exactly what we want. So I can assure you that there will never be a restriction that you cannot keep a doctor in White River Junction just because we have a CBOC here in Brattleboro. Now, that doesn't mean that we don't have great services here, but we really respect and support that close relationship and encourage that. So we would not expect you to change that.
Thank you. My second question dealing with, I was a Category 7. I think I'm now a Category 8 in the reshuffling. So for a travel pay is not an issue. And I do pay a copay, and personally believe that maybe all of us ought to pay something. So I'm not totally opposed to that. But I'm also under Medicare. So I spend a lot of money on Medicare, and the VA will not take that. So I am spending money on Medicare, going to the VA because that's where I want my care. I'm very pleased with it, but I'm also wondering why I can't get some kind of reimbursement from my Medicare.
That's an issue that's been debated for a few years. And Steve knows more about it than I do, but I think the answer is, Medicare is saying, it's all in the family, they would like to keep the money and not share it with the VA. But the point that you're making is VA takes many insurance claims. You're asking why not Medicare? And the answer is, Medicare says we have our problems too. We want to keep the money in Medicare. But it is an issue that has been discussed. Yeah.
Thank you. My name is Bob Berlani. I'm a physician in Brattleboro. I'm a Vietnam vet. And I have a question for the Senator. Thank you very much for being here to share the Veterans Affairs. I think you're the right man at the right time. Appreciate it very much. First of all, I want to say what a nice feeling it is to be in a room with so many veterans and veterans' families. It gives me great pride to be a veteran. I'd love to talk to you later about Vietnam. Being a physician in the community, I look forward to continuing to work with Dr. Orland, a colleague. And I have an idea. I think as a physician and as a primary care physician and as a veteran, I'm more aware of veterans. I ask a lot of my patients whether they've had veteran experience, and I think that I can help this collaboration. But I think a lot of other physicians, and most of the younger physicians who are not veterans, may not be so aware. My suggestion, you might want to try a pilot in this community, having information going to all of the primary care physicians' offices, about 30 primary care physicians in Brattleboro, such that the information can be given out to our veterans as they come in, and it'll make our physicians more aware of whether their patients are veterans, and then make them aware of possible collaboration and benefits of the veteran system in town here. So this is new to us. Okay, that's my comment.
I think that's a very sensible idea. Okay, thank you very much, Dr.
That's also a big selling point. That's also a big selling point for the integrated electronic health records that we're trying to get the VA and DOD to agree on so that they can transfer information to you that goes all the way back to the guy's military career.
Senator, through our office, we actually get the brochures from, can you hear me in the back? Richard Reed from the Office of Veterans Affairs in Montpelier. And when our service officers go out, part of what we do is we have a two-sided pocket pamphlet that comes from the VA. It basically says, I served in the military, I served in these areas, and these are the things I would really appreciate you, doctor, keeping an eye out for me. So if I was in Vietnam, you should know that so you can keep track of my blood sugar and my prostate. And for folks coming back from OEF, their related issues. And we're hoping, in working with Deborah, to contact all the physicians in the state to make sure every physician in the clinic has at least one of these.
Good, great, thank you, Richard. Yeah,
Bob Pixley, I'm the commander of the DOD. I have a question that, I don't know, maybe everybody here understands, but I don't. How is Obamacare going to affect veterans?
Well, for a start, VA remains independent. So if you're using the VA right now, nothing changes. I think that's the short answer.
Okay.
The VA remains an independent entity. One area where it doesn't impact, but it can be of use, is if a veteran has no health insurance right now, and would have to pay a fee, they will walk into the VA and not have to pay that fee. But to the best of my understanding, VA remains as it is. You're in the VA, you stay in the VA. Yeah.
Sue Hammond from Martinsville, Vermont. I have a question about children of veterans. I'm an Army brat, and I work a lot in Vietnam with children and people affected by Agent Orange, and also here in the States with veterans' children who believe their health care issues are caused by that. And then hearing the news about Camp Lejeune and all being on many Army bases throughout my life, I'm just curious, is the VA doing about looking at impacts on children who may be affected?
We are looking at Camp Lejeune, that's for sure. And obviously, if there are environmental disasters like in Camp Lejeune, the children will be covered. So in general, it's something that the military does impacts kids. The kids will be covered.
Just let me add to that. You know, I think in terms of the psychological impact that having a parent who is deployed or who returns injured, that VA is really focusing on that these days. For a long time we didn't, I will say that, but I think we've come a long way. Our vet centers certainly invite families and children to come in and participate in care. We do the same in White River Junction. In fact, if you go to our residential recovery center on a Saturday, you will find lots of little children there with the veterans getting care because they are part of that family system. So I think we continue to grow that concept and to make sure that we are also extending the care in that direction. We recently had actually at the White River Junction VA a training from the Military Child Education Coalition, which was just focused exactly on this. Sensitivity and awareness of what the impacts are on children of having a parent who's deployed.
Okay, we got a question back down?
Yes, I'm here. It's great to see a person like you. I've been following you for years. You're a great senator. And White River Junction, I go up there quite a bit. And I can't say enough about how good the doctors and the personnel are. And a lot of the people that work there are veterans, which is very nice. It's nice to have them home and get pushed on. But my career, I started in the late 50s, New York City Police Department. I was in the Police Commissioner's Crime Task Force. And then I switched, I was a commander in the New York City Fire Department up in Harlem the last 8 years. And we have a program for the veterans of foreign wars.
Hold that mic a little bit closer to your mouth, please.
We work with the police department and a fire department, and we have sweeps. This is for a group that's not represented here. These are people who have post-traumatic stress or mental problems. We find them under bridges, we find them in parks, we find some are frozen to death. Last year we had 7 of them frozen to death in a park. Now, when we pick them up, the police take them to a place in Queens. They have quarters for them there, and they sleep, they get cleaned up, they get food, and the next day they have the Veterans Administration have people staffing it. They get medical care, they're recommended to doctors, they get counseling for education, they get help financially, they put them on their feet. And the big thing is these people cannot function, they can't take care of themselves. Their families can't get in touch with them. And I'm only bringing this up because these people aren't represented here. You know, thank God we have people like, you know, Senator Sanders and the VA, White River Junction. I'm very happy. I have no complaints. But I don't know how to address the problem.
Well, you raised a good point. And that program didn't happen by accident. And I mentioned earlier that the VA is now being more aggressive in dealing with homelessness. But your point is, you know, a homeless person in most cases is not going to come walking in, or somebody suffering from severe mental problems is not going to come walking in and get the help they need. You've got to go out and find them. That's your point. And you're absolutely right. Those programs didn't happen by accident. There are people who push them. Deputy, you want to come in?
Yeah, just that we do have actually a terrific staff, our homeless team, that does exactly that. They go out into local communities and find homeless veterans. We now have a program where we can provide housing right off the bat for folks, but with that comes case management so that we look for long-term solutions to really get people's lives back together. But it comes back to one of the other comments about community participation. It's very important that our teams collaborate with community providers because sometimes it is community providers that find veterans that don't come to our attention. So very important that we're doing a lot of connecting and outreach with some of the community agencies, physicians, and so forth. And our vet center also, many of you may have noticed the mobile van the vet center has out in the parking lot. They are also out and about on a very regular basis around the state. And one of the issues that they are addressing is to look for homeless veterans and bring services to them.
Okay. What I'd like to do is take a few more questions. Tom is going to lead us when we're finished in God Bless America. And Steve is going to be here and Sam with Sango. Sam is here. And if anybody has any issue that they want to try to have us resolve, those two, and where's Dan? Dan, you're here too?
Yeah.
All right, so we have plenty of staff here to deal with. Phil,
I don't think we said thank you to the staff here in Brattleboro. They deserve a round of applause.
They sure do. Thank you. Please get the word out to your friends. There are people in Windham County who do not know about this fine facility, and we want them to be able to take advantage of it. Are any other questions or comments? All right, we got folks here who will, yeah, okay, we've got a question back there, we last, and
Actually, it's not a question, I just want to put out there, I have new local TV specialist for White River Junction. We have application packets here, we have someone from eligibility and enrollment, so come on down, ask us any questions. If you know of a veteran that needs to get into the healthcare system, you want to grab an application packet for them, feel free. Also, we'll be at the Strolling of the Heifers next Saturday, myself and Jerry Greenwood. So come on down, just stroll on over to the Movie Vet Center, say hi.
Great, thank you.
I've been asked to, we have a little survey. Where are our surveys? Are they at the table over there? Okay. They just asked about additional services and things that you might be interested in. So if you have an opportunity, stop by and fill one out for us. Thank you.
Last question, yes, sir.
Wayne Bailey. I was just wondering if anybody has any information on snowbirds when they go to Florida and if they need VA care. I happened to go down this winter and needed emergency care. I went to the VA in Punta Gorda and they didn't even want to talk to me. Wouldn't even
You went to a VA facility in Florida and they didn't want to talk to you?
Yeah, and I talked to several veterans down there, and they said they were having the same problem.
Well, that doesn't sound right at all. So if do you get your care here at the VA?
No, they wanted you to sit down and fill out all the forms as you need 14, fill out just like you're registering for.
Her question was, do you get care here at the VA?
But
I get
if
care
you,
here. Yeah.
Yes.
You do get your care here, okay. So that should not be the case. You do need to register to that local VA, but we can access all of your records. They will be able to see your health care record. And know that if you ever have an issue like that, we want to hear about that in White River Junction. We will call ahead, make sure they know you're coming, and make those arrangements ahead of time. Because it certainly should. That's one of the beauties of VA is that we have one electronic health record, and we have facilities all over the country.
I mean, I just said to them, here's my last four and my name, showed them my VA card.
But that's just not the right reaction. Shouldn't happen that way.
I think what Steve tells me is when you go to Florida, you go into another visit of the district. You may have to hold your nose and fill out some paper because you're in a new visit. But once you do that, you're in one system, okay? So hold your breath, fill out some forms, and it should work. All right, let me just say this. I want to thank all of you, not only for your service to our country, but thank you for coming out here this afternoon. The VA system is a different system than any other system because it's your system. You own it. It's yours. I think here in Vermont and nationally we have a pretty good system, but no system does not have its share of problems. No hospital in America does not have its share of problems. So our job is to work with you to get your ideas, your input as to how we can make the system the best that we can possibly make it. And I know that I speak for Dr. Orrin and everybody else up here. We want you to come in, we want your ideas, and we thank you very, very much for all that you've done for our country. Tom Burns has sung at many of our events, and Tom, you're going to lead us in God Bless America? Okay, let's do it.
First of all, let me just tell you that if you look around, you may see some vacant chairs. Some of those chairs could have been filled with military personnel who are now over in harm's way defending us folks. Now, we all know, we're told that singing is praying twice. So let's get some extra credit for our troops overseas and ask the Heavenly Father in a song to bring them home as soon as He can. So please join me now. Let there be peace on earth. Let there be peace on earth, and let it begin with me. Let there be peace on earth, the peace that was meant to be. When God as our Father, brothers are we. Let me walk with my brother in perfect harmony. Let peace begin with me. Let this be the moment now.